Regenerative medicine and stem cell therapy are exciting new areas in the world of medicine. There are a good bit of basic science studies involving orthopedics and sports medicine applications for stem cell therapy. There are also some clinical studies involving stem cell therapy. This video will serve as an overview of stem cell therapy in orthopedics and sports medicine.
A 17-year-old female soccer player sustains a non-contact knee injury and tears her ACL. A 47-year-old competitive tennis player has a partial thickness rotator cuff tear. A 24-year-old basketball player jumps for a rebound and ruptures his Achilles tendon. A 17-year-old baseball pitcher sustains a significant partial tear of the elbow UCL, and a 67-year-old mature athlete is limited by progressive knee osteoarthritis. So can we help these athletes beyond traditional treatments? Enter stem cell therapy. So how might these athletes be helped? Well, possibly shorter healing times, quicker return to play, better healing tissues, slowing joint degeneration, and avoidance of surgery. So what are stem cells? Stem cells are cells that have the ability to divide and replicate and become other more specialized types of cells. Here you can see one cell replicating into numerous others, and this can be done millions of times. Stem cells are unspecialized or undifferentiated, and what that means is that a single stem cell can turn into tissue for bone, for eye tissue. It can become cells that make heart tissue, kidney tissue, and can form cells that can make muscle tissue and really every tissue in our body. Now, so differentiation means that the cell will acquire characteristics specific to the certain cell or tissue type, contribute to the healing process, and replace dead or damaged cells at the site. There are different types of stem cells, and let's talk about those. Embryonic stem cells are cells that are from the inner cell mass of the developing embryo, and they're donated for research with informed consent. These are the most powerful, and we call them totipotent. This means that they can form every type of cell in our body. However, there are immune reaction concerns with these, tumor formation concerns, ethical controversy, and an uncertain legal status. And because of that, these are not used in stem cell therapy right now. So what are stem cell sources for orthopedics then? Well, mesenchymal stem cells would be the main one. And mesenchymal stem cells can come from bone marrow, adipose tissue, amniotic fluid, umbilical cord blood, and placenta and cord tissue. How are mesenchymal stem cells acquired? Well, there are adult autologous stem cells, which means it comes from the actual adult themselves. That's what autologous means. They can be taken from fatty tissue. These are the adipocyte-derived stem cells. They can come from the abdominal fat and then can be ferreted out. They can come from the bone marrow, and the classic place is the pelvis, the posterior or back part of the pelvis. Here's how that's done in the operating room setting under sedation. A needle is placed into the pelvis in the posterior part where there's the richest supply of stem cells. A syringe is then utilized to draw out the bone marrow cells. The bone marrow is drawn out in 5 cc increments, and then the needle is just adjusted a little bit so that a different area can be harvested from to optimize the amount of stem cells. A 60 cc syringe of bone marrow is filled up, and then another one is filled up to make 120. The bone marrow is then placed into this flow cytometer, which separates out red blood cells, platelet-poor plasma, and ultimately the stem cells. Here you can see the stem cells being injected into the knee joint at the completion of an ACL reconstruction surgery to optimize the healing environment. Then there are neonatal stem cells, and this means it comes from the newborn. And these can be taken from the amniotic fluid These would be called amniotic stem cells or growth factors. Can also be taken from the amniotic membrane as well. Another popular place to take it from is the placenta and the umbilical cord tissue, and these umbilical cord stem cells actually have some of the most live stem cells of any of the other types. So what might stem cells actually do once they're injected into a site? And this is based on in vitro and animal studies. There's a process called homing in which the cells migrate to the point of interest, and then they can recognize inflammation and recognize tissue injury. Once the stem cells are in place, they can replicate, they can differentiate, and then they can substitute for damaged or lost cells. There's another function called paracrine signaling, and what this means is that the stem cells stimulate local cells and tissues in helpful ways. And some of the ways they can do this is they can cause the local cells to secrete helpful substances that we call cytokines. They can create an anti-inflammatory effect and also create an anabolic environment. Anabolic means tissue will be built up or grown. So what are some orthopedic and sports medicine applications for stem cells? Well, knee osteoarthritis is a big one. And knee osteoarthritis involves the loss of cartilage on the ends of the bone, which are very important components of our body. This X-ray shows a front view of a knee. The two blue arrows represent the black spaces between the bones. They're equal. F stands for femur, T stands for tibia. And if we look at this X-ray, the orange arrow has a narrower black joint space, and that means that there's cartilage loss, and that's consistent with osteoarthritis. Well, what happens when there's this cartilage loss is that the other cartilage cells are unable to maintain a functional cartilage structure to compensate for the damage and cell loss. And there really are no current treatments that cure or halt this disease progression. So what might stem cells do for knee osteoarthritis? Well, they can differentiate into new cartilage cells, suppress inflammation, and release substances to combat the degeneration, such as cytokines and cartilage proteins. There are numerous ongoing human clinical trials evaluating stem cells in osteoarthritis of the knee. This study looked at 18 patients and utilized adipose-derived stem cells and had 2-year follow-up and showed significant improvements in several validated knee scores. This study looked at amniotic suspension for knee osteoarthritis, and with just 6 patients, showed improvements in knee outcome scores at 12 months. Umbilical cord stem cell injections are exciting and have a lot of live stem cells, and this is how it's done. The placental cord tissue is first drawn up, and that's 1/2 cc, and then we draw up the umbilical cord stem cells, which is 1 cc, to make 1.5 cc's. The knee joint is then anesthetized with this ethyl chloride, and under ultrasound needle guidance, to see exactly where the needle needs to be in the knee joint, these stem cells are injected into the knee. Now what about rotator cuff tears? Well, the rotator cuff is a complex of 4 small muscles and tendons that envelop the ball and socket of the shoulder and are very important to the function of the shoulder. It's a large problem in mature athletes, and there are actually about 250,000 rotator cuff repairs every year in the United States. There are also rather high re-tear rates after these repairs. This is a rather large rotator cuff tear. This is the free edge being grasped by the grasper and being pulled over to the bone. This is what it looks like after it's repaired, but now it has to heal to the bone, and that's where stem cells could come into play. There's really one good clinical study that looked at stem cells and rotator cuff repair, and with bone marrow stem cells, this group showed better healing by MRI in the stem cell group. Although it's only one study, there's the potential for the addition of stem cells to rotator cuff repairs to improve healing. And there are numerous other potential applications out there, and hopefully will be the subject of future videos. These include rotator cuff tendinopathy, tennis elbow, shoulder osteoarthritis, ACL tears, elbow UCL tears, patellar tendinopathy, knee meniscus surgery, meniscus tears, and more to come.